The natural history in medicine has been that we initially learn how to do things in a very invasive and very open fashion. Traditionally, ACL surgeries were done in an open fashion where the whole knee joint was opened and the ACL was replaced. Now they've developed that arthroscopically, so they can do that through a couple of cameras and very small incisions. That same evolution happens through sports medicine and through our procedures, where we take something that traditionally is very invasive, we try to minimize the invasiveness of that procedure. So we try and take that recovery and that incision healing time and substantially reduce it. That allows our patients to get back to what they want sooner. At Mayo Clinic, you have a team of specialists, not just one specialist, at your disposal. And so when you come to see me or one of my colleagues, you're gonna get a whole group of individuals, physicians, physical therapists, physician assistant, athletic trainers, who all work together to solve problems. And so we don't work in a silo, we work as a team. We want people back to their activities faster and with less recovery and less risk. And that's why we innovate on a daily basis. There are a lot of benefits of minimally invasive procedures. These include lower costs because we can do these in the clinic and not in the operating room. There's reduced risk of general anesthesia because most of these can be done with local anesthetic only. There's a reduced risk of injury or problems with wound healing because instead of having a long incision, we can make that through a micro incision. And then there's a quicker return to activities because instead of creating a lot of trauma to get down to the thing we want to treat, we can do that in a minimally invasive fashion and limit the trauma to the other structures in that area. One advantage to coming to Mayo Clinic for these minimally invasive solutions that are typically performed under ultrasound guidance is that you have a group of experts in diagnostic and interventional ultrasound, one of very few practices in the world that are accredited by the AIUM in both diagnostic and interventional ultrasound. We take something that traditionally would require an incision, and we can do that maybe with a needle or a very tiny incision. That means a faster recovery time, a lower risk, and a quicker procedure performed. Patients from around the country seek us out because they understand that we're going to get to the bottom of their problem and we're going to come up with a solution for that problem. And that solution may be a traditional treatment option, such as a surgery in the operating room, but that solution also may be a minimally invasive procedure. When I see patients who come for these solutions, I'm talking to our specialists in other disciplines, our orthopedic surgeons, vascular surgeons, trying to assess what the right treatment for that particular patient will be. At Mayo Clinic, we always ask two questions before we develop a new procedure. One is, can we? Two is, should we? And if we can answer yes to both of those questions, together we will come up with a treatment option or a solution that we think may be viable.